America's healthcare system promises healing if you've got deep pockets. But what if chasing doctors and insurance is making you sicker? Welcome to Stoic Mind Daily, where we shred healthcare myths with Stoic wisdom. Today, we're tackling affordable care without begging for coverage. Healthcare costs in 2025 are crushing $10,000 average for a hospital stay. 66% of bankruptcies tied to medical bills. Chronic illnesses like diabetes or arthritis make it worse. Society says, get better insurance. But Stoics like Epictetus teach us to find solutions in what we control, our resourcefulness, not our wallet. If you're struggling to afford care, this video will change your life. Ready to master healthcare like a Stoic? Smash that subscribe button and join Stoic Mind Daily to conquer life's challenges with wisdom. Finish this video and subscribe to unlock the educational benefits that will transform your mindset. We'll expose why healthcare fails, how Stoic resourcefulness beats endless bills, and 5 practical steps to access affordable care. Plus, a story of Stoic health freedom. Let's dive in. America's healthcare system screams, pay up for premium plans, see top doctors. But Seneca said, we suffer more in imagination than in reality. Chasing insurance or specialists fuels fear, and debt. 50% of insured Americans still skip care due to costs. Why? You're betting on a system you can't control. Picture a 40-year-old mechanic in Georgia with chronic asthma, facing $500 monthly inhaler costs. Insurance denies coverage. Bills pile up. He feels trapped. Stoics would say, stop waiting for healthcare to save you. Find freedom in what you control. Affordable care isn't an insurance card, it's a mindset. Stoicism teaches us to master our choices, discipline, and resourcefulness. Healthcare in America is a $4 trillion industry, yet 28 million remain uninsured in 2025. Even insured folks face $5,000 deductibles. The system thrives on your dependency, pushing costly tests or meds. Stoics like Epictetus remind us, some things are in our control, and others are not. You can't control prices, but you can control your approach. Relying on healthcare giants strips your power. Stoicism hands it back through practical, low-cost solutions. Society says, get insurance or suffer. But Marcus Aurelius wrote, you have power over your mind, not outside events. Waiting for healthcare burns you out. Stoics choose resourcefulness. Find free or low-cost care with discipline, not desperation. Step 1. Research free clinics. Seek community health centers or sliding scale clinics. Journal. What's one local resource I can find? Step 2. Explore generic meds. Ask pharmacies about $4 generics or discount programs like GoodRx. Step 3. Negotiate medical bills. Call providers to lower costs or set payment plans. 60% of bills are negotiable. Studies show. Step 4. Leverage telehealth. Use free or low-cost apps for consults, avoiding $200 office visits. Step 5. Build preventive habits. Walk daily. Eat cleaner. Small steps cut healthcare needs. Pause the video. Write one free healthcare resource you can explore, like a local clinic or app. Share it in the comments to inspire our Stoic community. Stoic resourcefulness beats healthcare's bloated costs. Free clinics serve millions annually. Generics save 80% on meds. Negotiation and prevention shift control to you, not insurers. Stoics don't beg for care, they find it. Healthcare's a maze $300 average for a doctor's visit, yet 30% of Americans avoid care due to cost. Stoics cut through. Research uncovers hidden resources. Negotiation saves thousands. Prevention reduces visits. These aren't quick fixes. They're Stoic foundations for health freedom. Imagine a single mom in Ohio with rheumatoid arthritis, facing $1,000 monthly med costs. Healthcare says, get a better plan. But she turns to Stoicism. She finds a free clinic, switches to generics, and negotiates hospital bills. She walks daily and journals her progress. When a flare-up hits, she's empowered, not broke. That's Stoic power. Epictetus said, "Some things are in our control, and others are not." You can't control healthcare costs, but you can control your resourcefulness. A Stoic doesn't chase coverage. They chase solutions. Forget healthcare's pay or perish lie. Stats show 70% of medical debt comes from insured patients. Build a Stoic care plan. Research, negotiate, prevent. Journal nightly. What healthcare step can I control tomorrow? Research one resource weekly. Clinics, apps, or programs. Practice prevention. Track daily walks or healthy meals. Negotiate one bill monthly to build confidence. Visualize affordable care success to stay focused. Our single mom didn't stop there. She joined a free health workshop, learning diet tips that eased her symptoms. She reads Seneca, embracing discipline over despair. Her kids saw her strength, not her struggle. This isn't healthcare's fix, it's Stoic transformation. Fear of unaffordable care isn't about health, it's about losing control. America's healthcare sells the lie that money buys wellness. Stoics disagree. Reframe fear as a call to act. Instead of dreading bills, ask, what's one step I can take? Call a clinic, research generics, walk each builds resilience. You might think, I need insurance to survive. That's the trap. Stoics find health within. Try this. For one day, focus on free health actions, research, walking, diet. Notice the shift. Seneca said, you have all the happiness you need if you choose to see it. Healthcare fear fades when you control your approach. Fear amplifies costs, stress worsens chronic conditions, spiking bills. Stoics break this cycle by focusing on now. What resource can you find? What habit can you start? This mindset, paired with action, outperforms healthcare's empty promises. Today, we debunked healthcare's myth. Stoic resourcefulness, researching clinics, using generics, negotiating bills, preventing issues, beats America's costly system. Affordable care is a mindset, not a plan. Marcus Aurelius said, the impediment to action advances action. Healthcare costs aren't a trap. They're your Stoic training ground for 2025. Next, we'll tackle pain management with Stoic strength. Comment below. What's your biggest healthcare challenge, and how will you face it like a Stoic? See you in the next video.